Welcome to the Hank Cisco Show. Ladies and gentlemen, don't touch that dial. We're going to have a physician here, and he's going to make a house call, and it's not going to cost you anything. You know, we have a doctor coming into your home and doing a house call. And my guest today, ladies and gentlemen, is Paul R. Casey. And you know, he has the big word cardiologist, right? But it's a heart doctor, right?
Correct.
One of the top in the area, most respected, one of the top respected doctors in this whole area. And he's with a large staff of doctors in this office. Now, you know, I always said, my daughter says, Dad, let the guests talk. So, you know, you have a lot to talk about, and there's a lot of information here. If you got a paper and pencil, write it down, because there's a lot of good stuff here on how to take care of yourself. You know, the heart, that's most important. Baby, when that goes, everything goes. So we have our guest here, Dr. Paul Casey. And
thanks for
now
inviting
start
me.
telling me something about yourself now. I know you come from a family of doctors, right? Tell me who's all in your family that is physician.
Healthcare is a Casey family tradition. My father was a physician. He passed away last year. My brother's a heart surgeon, formerly at Lankenau and now up in Scranton, Pennsylvania. I have several.
Where?
Scranton, yeah.
Oh, yeah, okay.
I have several sisters that are nurses. My daughter is in nursing school.
You can start your own hospital.
Yeah, so it's healthcare is a Casey tradition, and
my God.
I'm proud to be able to practice in the Norristown area.
Oh, man.
It's been very exciting for me for 25 years. I've been in Norristown.
And now tell me something about your family. I always want to know about your family, because I know you're
well, I'm a
you
lucky
know,
man.
You
I'm
look
a very
young, but
lucky
you've been
man.
around a long time.
I'm a lot older than I look.
Yeah, but I'm
But
81, so, you know.
But
so.
I married to Kathleen Casey, and we have 5 lovely children. And
5?
Yeah, 5.
What's the first name?
CJ, she's the one that's going to nursing school. I have a Paul, who's Paul Robert III, Terrence, Patricia, and Michael. 3 boys and 2 girls.
And they're none in elementary school. They're all.
No, I have 1 in middle school right now.
Middle school,
Right,
okay.
Right.
All right. And your wife? What?
She, as a volunteer, has been for 20 years at Montgomery Hospital.
Oh, yeah.
Yeah, and she helps run the gift shop at the hospital to help raise funds for the hospital.
Oh, okay.
Right, and she's been very involved in the community activity in the Norristown area with a clothing drive in Norristown.
Oh, good.
And also a
That's
tri-hospital
great.
committee from years ago.
You know, all right, now where's your training? Everybody, you know, you want to look at your background as far as training.
Yeah, I went to college up in Scranton, Pennsylvania, the University of Scranton, and then medical school at Temple University in North Philadelphia.
Okay.
And after that, I trained at what was called the Medical College of Pennsylvania, since recently closed. I did my medicine and cardiology training there, and then I came right to Norristown after that and worked with
How many
the
years
late
you been in
Dr.
Norristown?
I've been since 1980,
1980.
25 years.
Oh, my God.
Yeah, I came to work with Sal Carfagno and Jimmy O'Brien back in 1980.
Yeah, and I know them both. Yeah, great guys.
And we've been in practice here as a group for all that time, and very proud of it.
Yeah, you got, what's in Dr. Belbor, right?
Yeah, Art Belbor is one of our associates. He's been with us since the mid-'80s.
Yeah, I think we're going to put the names of them on the screen, because they're all, a
great-
lot of people
great
in
guys,
Norristown are being treated by
I
your
learn on a
office.
daily basis from my partners.
Yeah, great.
And my
you know.
patients.
Huh?
And my patients teach me too.
All right, now, your experience, let's tell me something about your experience now. Now, you're a consultant in Philadelphia.
Our practice title is Cardiology Consultants of Philadelphia, but mainly we're a practice here in central Montgomery County. We practice in Norristown since 1980.
That's Montgomery Hospital.
Montgomery Hospital, Mercy Hospital,
Okay,
Mercy Suburban Hospital,
okay.
right up the street, and we have offices in East Norriton, up in Collegeville, and of course right across the street from Montgomery Hospital in Norristown.
You have one on Germantown Pike here.
Yes, brand new office. Yep.
You in that office too?
Absolutely.
Oh,
yeah, it's been a great.
You were in Montgomery
The
Hospital.
community
now.
has been very, energetic with our practice, and we've had to expand to address the needs. So it's worked out very well, and we have good doctors who we work with.
In fact, I got an appointment next week. I got to take a stress test.
Good.
Got a shadow box, left, right, bop, bop, bop. You know.
Yeah, you'll do well, I'm sure.
I don't know, but okay. Now, there's so much I want to talk. I want so much that I want you to tell our viewing audience. Now, there's we put something on the new technology, you know, in our community. Let's talk about this Norristown area. We're talking about revitalization. We're talking about the hub. You know, we got Montgomery Hospital, 115 years. 115 years, one of the oldest hospitals in the area.
Yeah,
you know?
Yeah. I know you're very enthusiastic, and it's first of all, I have to thank you for inviting me to come, and it seems perfectly appropriate to present some new technology in our community on your program, because you do a lot of you promote a lot of things for the community of Central Montgomery County, and we're grateful for that. And through the efforts of Montgomery Hospital, the board of the hospital, the cardiologist, over the last 10 or 15 years, we've been trying to advance the service of cardiology in Norristown. Going back 10 or 12 years, we opened a cardiac catheterization laboratory. That's where we do invasive testing of the heart.
What's that? In other words, somebody gets a little problem, they run something through the veins or something?
Yeah, exactly. We do procedures where dye is injected into the arteries of the heart, and then we'll show a picture a little bit later.
That's in Norristown. You do that?
Yeah, we've been doing that for quite a few years, but in the last 6-8 months now, we've got special permission from the state of Pennsylvania through petitions from various hospitals in Montgomery County with the help of Temple University. The state of Pennsylvania allows us now to do procedures in the heart to open up arteries that are blocked. And this is a special consideration, a special approval to bring the service to the community rather than bringing the patients to the other institutions where we had to do it in the past.
Yeah, I know.
It's been very successful.
I remember you mentioned way back, I was in a hospital for something, I forget what it was, and you were telling me that there was something that you detected with the dye and everything, but they had to go someplace else.
Right,
you know?
exactly.
So now, you can do it right here.
Exactly.
Boy, that's advanced.
If I may, maybe it would be a good time to use an example. You know, if someone were to have chest pain and they come to Montgomery Hospital, paramedics believe that they are having a heart attack because of the quality of the symptoms that they have. Electrocardiogram and EKG, which is a test that we do on the heart, helps confirm that. Now, after this approval from the state of Pennsylvania, we can take that individual right to the cardiac catheterization laboratory and find out where that blockage is. All right? And for
you don't lose any time transporting somebody.
Exactly.
They can die on the way.
Yeah, they transport right to the local community hospital. It's a new approval. It's an old procedure. Been doing it for 10 years at other institutions, but it's new for this community. And I have a drawing. First, I want to point out something on the heart. If someone were to have chest pain and a heart attack, the artery is one of the blood vessels on the surface of the heart, and that artery feeds the heart muscle. So if that artery gets blocked, that's a heart attack. Okay? So now we have a drawing that I believe will show up on the screen, and the drawing, slide number 1, will show an artery with some plaques in it, and those plaques are of cholesterol build up. Yeah, and one of those plaques breaks, ruptures, and the person gets chest pain. And on that drawing, you'll be able to see there's an area where there's a clot that fills up the artery that prevents blood flow through that artery. And that's a heart attack. Well, in the old days, we used to give drugs to open up that artery. Now we take the individual
try to dissolve it,
right? And that worked pretty well. But much better is what's called primary angioplasty, where, and I'll show you on the second slide, where the artery that's blocked up, there's an obstruction there. A balloon catheter is placed in the area where the blockage was. That balloon is inflated, and then a wire mesh is used to keep that artery open.
That wire
mesh is like a spring. It's like it helps keep the artery open, much like the wire in a vacuum cleaner. You're familiar with that? How a vacuum cleaner has a wire in it to keep to keep the tube from collapsing. The wire mesh does the same thing in the heart, and then the patient becomes pain-free, and it decreases their mortality, the likelihood of dying, and improves their outcome dramatically by prompt attention for this type of procedure.
You had to do a little politicking to get that here, right?
Yeah, we had a lot of help from the institution, Montgomery Hospital.
Right.
A lot of the community help. The community was very helpful in supporting this project because it helps the community by having the service locally. It helps the community by bringing very skilled physicians that had to work at another hospital to do this procedure and bringing them back into Norristown. And it's a service that helps all the communities. It helps both hospitals.
And I don't know, I'm talking as a patient. When you have a hospital that don't have all these facilities and things to work with, the doctors go to someplace else, right? So
Yeah.
now I understand they're coming back because we have the thing. So
we're bringing the doctors to the patients,
right,
rather than the patients to the doctors.
Yeah,
which
that
is really,
good.
That's very helpful for the community. And I believe, it's my personal opinion, that bringing this service to this community is really what influenced the state of Pennsylvania to allow us to do this. To my knowledge, there's 8 or 10 hospitals across the state of Pennsylvania that have this kind of special permission.
Okay.
And it's been tremendously successful. At Montgomery Hospital, we've done about 170 individuals. Probably maybe 20% of them were scenarios where they had a heart attack and had to go right to the cath lab immediately.
Now,
It's been very successful.
Who is at risk for a heart disease?
Heart disease, risk factors for heart disease are very important, because this allows some individual to know whether or not they should be checked, or whether they should have a stress test like you're going to have. Risk factors are smoking is the most important one.
Stop smoking, okay? That's for my staff here.
Right.
Or our staff, or our helpers here, okay? Nobody smokes, right? Good.
Yeah,
None of your relations, right? No, you
right.
better not.
Yeah.
Okay, go ahead.
Not smoking, stopping smoking is very important. Diabetes, that's where people have high blood
Yeah,
sugar. Diabetes is a major risk factor for heart disease. As a matter of fact, we treat every diabetic as if they already have heart disease.
Oh.
They're special, they're VIPs in our practice.
Yeah.
People have a strong family history of heart disease. Like
okay.
father or grandfather died in their 40s or early 50s.
Check that out, right?
Yeah, those are risk factors. High blood pressure is a risk factor, and obesity, being overweight.
Too much.
Yeah.
Too much pasta.
Yeah, if you eat too
much
much and your
ravioli,
cholesterol goes up.
lasagna, right?
Right.
Yeah, take it easy.
Controlling the cholesterol, watching your diet. If you have diabetes, managing it correctly, aggressively,
Right.
and not smoking. Those are really major risk
They're
factors.
key things.
Exactly.
And how about symptoms of what?
The symptoms of
to
heart
look out?
disease, they can be subtle, especially in women. Symptoms can be shortness of breath. The most dramatic symptom that's hard to ignore is severe crushing chest pain.
Let me ask you, you mentioned it's about women. Excuse me. Is there a different symptoms between man
for men and women? Yeah. The typical symptom, the typical symptom for a man or a woman, what's usual, is crushing chest pain, where they feel like an elephant sat on their chest.
Oh, in other words, it's pressing.
Yeah, and that's very severe. Sometimes it radiates to their jaw or their shoulder, and it may be associated with shortness of breath or sweating. Atypical symptoms, that is, are more common in women. That is a symptom of just shortness of breath or fatigue. It typically might be in a woman who's diabetic and maybe smokes, so their risk factors are very high.
Yeah.
Maybe after menopause, if a woman has those symptoms, they're at great risk for coronary disease. So the symptoms are a little bit different in women. It's important not to ignore the symptoms, especially if they last for 15 or 20 minutes.
You want to take care of the women because they take care of us, right?
Right.
But now the men. All right, so the guy gets that feeling. What's the best thing to do?
Now, if someone has chest pain and their symptoms are severe, the first thing they should do is pick up the phone and dial 911.
Right.
You know, that response, and it's a great service in our community, the county and the region.
911's a great service.
Tremendous service. It's really helped expedite the care, because the key for anyone that has a vascular event, whether it's a heart attack or a stroke, is getting medical attention quickly. Right. If you have crushing chest pain or severe chest pain, or you're very uncomfortable and you're not sure why, especially if you're one of those individuals that has risk factors like we talked about, then what you should do is pick up the phone, dial 911, tell the operator, the person answering, what the problem is, and they'll distribute appropriate care to you.
They'll be prepared when they get there.
Exactly. And then that person would come promptly to the hospital, to Montgomery Hospital or Mercy Suburban Hospital, and then they would be evaluated.
They're ready for you.
Exactly.
Yeah.
So that's the key. A quick response to a sudden symptom is very important.
Now, okay, so now we mentioned now the action to be taken. There's nothing other than calling 911. Is there anything that they can do?
Well, if
for
they're
themselves?
at home, yeah, if someone knows they have heart disease and they have sudden severe chest pain, taking 2 aspirin and chewing them can be very helpful. All right, aspirin is a blood thinner.
Wait, run that by me again now. Hey, we're going to send you a bill here. We're getting a family physician making a house call, okay? So
Cardiologist
all right,
making a house call.
Right, okay. So, all right, now, run that by me again
Okay,
now.
if you have chest pain, you're at home,
Right.
and you have crushing chest pain, and you say, oh yeah, the Dr. Belbert told me a year ago I had a little bit of blockage there,
Yeah,
not to
yeah.
worry about it. If you have crushing chest pain, the first thing you should do is take 2 aspirin
2 aspirins.
and chew them. That's right. That helps. The aspirin
With
is a blood
water
thinner.
or just
doesn't make any difference. By chewing them, it gets absorbed very quickly.
So what's that do?
That's a blood thinner. It helps open up the artery. As you know from my drawing that we showed a minute ago or so, there's a clot that blocks the blood flow in that artery. The aspirin actually helps open up that artery. And it may relieve it even before you get to the hospital.
Well, then, would it be advisable to maybe take an aspirin a day, just as,
Well,
or maybe a
that's
baby
controversial.
aspirin, just enough to keep it?
If someone
the
has
flow.
documented heart disease or vascular disease, stroke or heart attack in the past, it's likely that their doctor is recommending that they take aspirin. There are certain individuals that cannot take aspirin, so I can't recommend that everyone take
No.
aspirin.
So you check with your
Check
physician.
with the family
right,
physician
okay.
about it. But
Well, we'll have to go to, check with your physician before you start taking any kind of
yeah,
medicine.
right,
No.
right.
Okay, now, tell me one of the most interesting cases that you've had, that,
Well-
an emergency type thing that, you know,
Yeah.
you're, you know,
It's, I'll tell you an example. Of course, I won't use any individual's name, but we've had individuals who were in the community. Individual was a teacher, as a matter of fact, who collapsed at school. Appropriately, the facilities at the school called, the support staff called 911. This individual came to the hospital, had documented heart attack, went right to the cardiac catheterization laboratory, where the procedure was done again, where they, if you're on the slide 2, if we could show that up
With
on
a
the screen.
balloon?
Right, where there was a blockage there, and the balloon was used to open up that artery, and then that stent was deployed to help keep that artery open. The symptoms resolved dramatically around that time, within an hour, maybe an hour and a half. And within 2 or 3 days, the individual went back home and recovered.
How about that?
Of course, we all know we have to take care of our teachers.
Yeah, definitely. We're here, right? We're right here, right in
So I
the
figure that's
TV
really
studio
important.
right here in Northtown High School. You know, I used to drive the emergency wagon, Northtown Police, years ago, and in the 50s. And I remember the patient went to the hospital. We took the patient to the hospital, and he was on the floor, and they gave him the shock treatment. You know, give him a little something there.
That's
And
right.
he was laying there, and I never saw anything like it. And they just put that little, it's a round thing, and they just put it in and boom.
Yeah,
you know,
defibrillator.
and his body like just almost come off the floor, like, you know, just
Yeah.
a shock, pow. And
Yeah.
that stimulates the heart, I guess, right?
Yeah, that defibrillator, or AED they're called.
They still do that?
Absolutely. And as a matter of fact, many
And
of
then
them...
they start pressing and pressing.
Yeah,
you know.
well, sometimes it's not necessary. If you get to a situation, many institutions like schools, airports, shopping malls, they have these defibrillators at the site where trained personnel can attend to someone even before the medics get there, and then
Yeah, sure.
identify the abnormal heart rhythm and give them one of those shocks that you talked about. It used to be that individual, back when you were running the ambulance, you had to take the patient to the hospital
You're
to get
right.
that shock.
Right.
Then over the next 20 years, the healthcare team would do it at the patient's home.
Yeah.
Well, now, wherever they happen to have this event, it's
Do it
called
right there, huh?
They do it at the site. It's called an AED. It's supported by the American Heart Association, and a lot of institutions around. Many schools have them. And
Schools should have that, don't you
I believe
think?
they already do.
Did-
Yeah.
Well,
yeah.
then maybe we ought to just touch base and see if schools have it. I think the courthouse should have it, with all the visitors and people.
Yeah,
Like
anywhere
if
there's a lot of-
the sheriffs and different people, you know, to train someone to do it. I think that would be good. Any place that where people come to gather, they should have someone trained to do the job.
Right.
And
yeah, the key is prevention, though. In order to prevent the sudden collapse or the heart attack or a stroke, from my understanding, and a lot of what we do in our practice is prevention. It is try to teach our patients and our community what's best to do to prevent having a heart attack or a stroke.
Right. And hey, when that goes, baby, there's no more, right?
That's right.
That's the main motor, keeps it going.
Right.
All right, now, tell me something more about, now, when you were in college, what did give you the first thought of wanting to be a doctor?
Well, that's a very interesting question. I actually decided I wanted to do medicine when I was in high school.
In high school?
Yeah. I observed my father, what he did for a living, and
what kind of doctor?
He was a surgeon. He was a surgeon.
Right. Okay.
And without any kind of family pressure, I was intrigued by this, what a physician could do, as I was growing up in the 50s and 60s. And to me, it was a dream. One way or another, I was going to deliver health care. And fortunately, through some effort and a lot of help along the way, I was able to finish my training in college and then go to Temple Medical School.
And then you took up with heart, right?
During my training, I realized that if you're going to attend to the real major needs of individuals, cardiology was the area to do that, because the mortality, it's the #1 killer.
When you started your office, you were with Dr. Carfagno?
Sal Carfagno.
Dr. OBrien?
Yeah,
right?
Sal Carfagno died back in 1982.
Yeah,
he was a real institution in the Norristown area, and I was proud to have worked with him.
Yeah, and then
Jimmy O'Brien just retired a few years ago.
Great golfer,
Yeah, great physician.
To help him out with a
great physician,
fundraiser.
Right? Yeah, he's a great physician and also an inspiration to me.
Your office was where?
Right across the street from Montgomery Hospital at 1330 Powell Street.
How about
the old office? The old office.
Calvin Finance.
Yeah, it used to be the old office.
That's the old office, right.
But we've been across the street from Montgomery for 16, 18 years.
Yeah. But now you're out.
And we're at East Norriton and Collegeville.
Yeah, and Dr. Carfagno, I remember wasn't he a physician for the Philadelphia Eagles there for a while?
That's correct, yeah. I can remember as a young cardiologist coming to practice here, we used to have the opportunity to interact with some of the athletes, review some of their electrocardiograms. They were special people in many ways. So.
Yeah.
It's very interesting times.
But you mentioned smoking. Stop smoking.
Yeah, risk factor modification is very important.
And when I was a county detective, and I was safety with the county, and it had to do with smoking. And I always tell them, I said, look, a family that smokes together chokes together.
That's right.
So,
and sometimes the family history of smoking is the family history of heart disease. They don't have bad genes. They have bad habits.
Oh.
So an individual, if a parent smokes, the likelihood that their child is going to smoke goes up dramatically. So it's very important that the parent or the grandparent take the initiative to change that bad habit, and it can result in dramatic improvement of health care.
We hear so much about the secondhand smoke. What's the scoop on that?
Secondhand smoke is a real risk factor to some degree for heart disease, certainly for lung disease. Any toxin for the lungs, and secondhand smoke is a major one. There's probably enough evidence to suggest that secondhand smoke also contributes to vascular disease like heart attacks and strokes. The key thing is, especially in the home, is not to smoke, so you can improve your health, and by not smoking, you'll be an example for other generations not to smoke.
And now I see where Commissioner Matthew, Commissioner of Montgomery County, trying to come out with something about not hiring you if you smoke.
Oh, really?
You're a risk, Right. So I don't know if it's going to pass or not.
Right.
But if you put on your application you smoke, you're not hired.
Right. You'll live longer. You'll have lower insurance.
Low insurance, right?
You'll need fewer medications, and you'll save a lot of money on cigarettes.
You're going to save a couple bucks. Stop smoking. And how much? Years ago, cigarettes were like 25 cents, 30 cents a pack, or 40 cents, and then it went to $1. Now, My God, it's $3.50 or so for a little pack for 20 little cigarettes.
Yeah, if it was
What?
$10 a pack, there'd be fewer smokers.
Oh yeah? Oh my God. Who needs that? We don't need that. Now tell me about a little bit about your family. I was really, all in medical,
Yeah,
had to do with healthcare.
Yeah, I'm very proud of that. With my immediate family and other relatives, I have a physician, a cousin who's an orthopedic surgeon up in Sellersville, Pennsylvania, another orthopedic surgeon in Reading, both Temple grads also. And I'm quite proud of that tradition, and it's a lot of fun. I really enjoy being a doctor.
Well, you must be doing something good because you look good. You look good. Yeah. And then now you practice also at the Mercy Suburban
Hospital.
Too, right?
Yeah, it's a great program they have
they're
there.
Doing a lot of.
They're cooperating a lot, the two hospitals, in the delivery of health care, and particularly in the field of cardiovascular health. And that's been, I've been on the staff there for 10 years and at Montgomery for 25. And it's great that there is so much cooperation, and we look forward to more.
Yeah, I'm going to have the top guy from Mercy Suburban here for an interview. And
yeah, we're blessed with two excellent healthcare institutions in our community.
I'm glad. Well, revitalization in the Norristown area, you want to get well, come to Norristown. If you want to live well, live in Norristown. So we're on the move.
All right.
Doc, thank you very much.
Thank you very much, Hank.
It's been a pleasure.
My pleasure.
I've known you
I'm
for
honored.
quite a while, and and I just so happy that you're able to come here today. I know you blocked off the whole morning, so all your his patients, please blame me. If you don't have to wait in the office because he's not in the office, okay? But ladies and gentlemen, thank you very much for allowing us to come into your home. We went, and I hope this program will help you help yourself, and that's what it's all about. So on behalf of Norristown High School and John Doyle, the director here and the teacher and all the students, I want to thank you for a great time here. Now, I learned a lot, okay?
Thank you.
So I don't
pleasure.
smoke, and I'm going to take care of myself, okay? So I can take care of my family, I can take care of the people in Norristown area, okay? So thank you again.